So we just did a distractive technique for the CT junction. Sometimes you want to do a little bit more rotation in that area, and that's what this technique is going to get into. I've got a couple of different variations that we'll do for this, as well as a couple of different ways of encouraging the patient to do most of the setup work for you. So if I have Freddie set up here, I can ask him to put his hand up here for me. Good. Now what I want you to do is I want you to tilt your head so that you're pointed towards that hand. Good, and also look up that way just a little bit. That allows me to get a slight bit of extension and the rotation at the spine that I want. Now, with this technique, the idea is that I'm stabilizing here, and then I'm going to stretch around my thumb, basically taking the contralateral facet joints and just gapping them with the technique. So I'd get a nice stable force that is just on the side of the spinous process. So if this is the spinous process, I'm coming in like that to it. My contact force on the opposite side, you can go through either the arch here, or you can go through the temporal bone if you need to. And then from there, you're just going to wind that person up by providing a lateral, slightly inferior force here, and then just some traction with the head. And then from there, your force or your thrust is just going to be a quick little movement with this hand going across, and just a slight, very slight increase in traction of the head. So now, sometimes our patients who have some of this thoracic spine pain, neck pain, may also have some difficulties or stiffness in the upper cervical spine, which makes it hard for them to lay in this relatively extended position for their neck. So what we're going to do is a slight variation to help out with that. Freddie, if you don't mind, I'm going to have you lay with this pillow underneath your chest. Good, and then put your head still down here. What that does is it allows his head and neck to rest in a relatively flexed position when we look at it compared to the spine itself. Now I can, in this, because I've got a little bit more freedom with how well his head moves by having his chest up a little bit, I can actually position him a slight bit more. So look straight down for me towards the table. I'm going to just cup his forehead in my hand. Here my thumb is going to go around that same spinous process with the exact same contact point as I had before. But I'm going to side bend him until I feel some tension build up around my thumb, and then I'm going to rotate him until I feel more tension build up. Then I just let his head rest. Now everything is the exact same. The only difference is because I locked him with the lateral bending first, I now have to go through the posterior aspect of his skull in order to create my contact point versus being over here. So it's more like this. And then my thrust is all the same. It's going to be predominantly coming across this way, and then this hand is just providing a little bit more traction.